And then we have the scientists, the medical doctors, and all the people that are actually in the field seeing the research, seeing the evidence, and actually looking at the raw data, and they're kind of on the complete other side of the fence saying two completely opposite things. And so one group is saying very severe problem, there's going to be many deaths, many illnesses, many missed days of work, and we need to have this virus, vaccine, we need to have it immediately. Doesn't matter if it's safe, doesn't matter if it's effective, we need to get it out there right now. Then you have the other side that's saying, hey, this is not that bad, disease is not that bad of a problem, it's producing relatively mild symptoms, and especially compared to a normal year's flu, we're not even as bad as a normal year's flu, and what are we going to be putting into people? And so over in Europe, specifically in United Kingdom, they're concerned about this specific disease right here, the Guillain-Barré syndrome. And so a lot of the neurologists are speaking out against the shot, saying, wait a second, this is dangerous. There's going to be a lot of cases of this Guillain-Barré syndrome if we're going to be giving this out to just the random public population. And so, has anybody heard of Guillain-Barré syndrome before? Right. Do you know what it is?
No.
It's basically paralysis, like you have a stroke and you can't move your body. And so it's a severe neurological condition. Basically, it's your body builds up an antibody. Remember we were talking about the antibodies? Instead of those antibodies attacking the virus, they attack your nervous system. And so instead of you fighting off a virus, you fight off your nervous system and it shuts things down. Some people can recover from it, some people don't. I had no clue as far as how common this was. Just as I'm talking to people this week about, hey, we're doing this talk, one of the symptoms or one of the problems is potentially Guillain-Barré syndrome. And it's surprising how many people I know that have either had it themselves or know somebody that's had it. And so it's kind of a scary thing. Poor safety testing, they're concerned about. The extra adjuvants that are not in normal vaccines that they're concerned about, because remember we had to have more of those to get the same reaction from limited quantity. Squalene and mercury are the two that they're concerned about mostly. We talked a little bit about squalene. Mercury, the reason why mercury is used in the shots is because when we're building a vaccine in a less than perfectly sterile environment, we're going to get a few other things that grow in the laboratory anyways. And so if you're looking at how do we grow a virus, we need this certain food for the virus to grow on. And believe it or not, other viruses like that same food, and other bacteria like that same food. So if we're going to have this food where viruses are growing, you're going to get some other things growing in there. Some of the ingredients, some of the places where they grow those, like embryos of chicken embryos to chicken eggs. So before they give you the shot, usually they ask you, are you allergic to chickens or to eggs? Because lots of the virus vaccines are growing on chicken eggs or monkey tissue, monkey kidneys. And so these are some of the extra viruses. There could be a bird virus or a monkey virus that could sneak in there, and they're going to be growing in there. Concerns over this Guillain-Barré, and then diseases producing relatively mild symptoms. So that's why some of the doctors are concerned about the shot.
Dr. Eric,
yeah.
So they put the mercury in there to kill off those other
They
viruses?
put the mercury in there to clean it up.
Ah.
So you can be less sterile, throw some mercury in there, mercury kills the extra stuff or breaks it apart, and then you can still have the shot that's relatively usable.
So why put it in there in the first place again?
Put the mercury?
No, the stuff. They put
Why
the
put
stuff
the-
in there, and then they put the mercury in there to kill the stuff.
Well, the
Yep,
extra
because
stuff.
you're right. Because if you don't have you can't give someone just a straight up virus, because that will get them sick,
Oh, I see
right?
what you're
So
saying.
you have to somehow weaken the virus, and then give the person the weakened version of the virus, and then their body will build antibodies, memory cells to that weakened version, so that when you see the regular version, you're already kind of prepared. It's kind of like me passing out flyers of someone that's, like a criminal, and then when you see the criminal, okay, don't go by that guy, or that's the guy you want to arrest. So
What's
that's
squalene doing in it?
the squalene. What that does is multiplies the effect, so you're going to build much more antibodies. it basically charges your nervous system. It's going to release a bunch more antibodies out there. That's one of the extra ingredients that they put in there. So instead of having a lot of that virus that your body can build antibodies to, you put the squalene in there and you build up much more, same amount of antibodies with a limited quantity of virus. So
And those two things have side effects that harm us.
Those two things have side effects that harm you. So mercury is a huge neurotoxin. The difference between mercury poisoning and autism, if you look at the two, you can't tell the difference on the surface until you go down and you test it at the microscopic level. So if you watch mercury in a laboratory and you put a little drop of mercury, tiny little bit of mercury next to a nerve cell, you can watch this nerve cell just go and just shrivel up. And so your brain actually absorbs mercury much more than blood. That's the scary part. So normally you have this blood-brain barrier that stops a lot of things from getting into the brain, stops a lot of chemicals from getting up there, but mercury can pass through that blood-brain barrier and then it can destroy neurons. So mercury poison is a really dangerous thing. And it doesn't take, we always see chemicals listed as parts per million. Mercury, in order to be toxic, is much less than that. Parts per billion or even parts per trillion can cause damage. So it's like having one little molecule in in a huge room that can cause damage if it's inside your body and attach it to the brain.
Well, what do you think that squalene is? That's like a poison accelerator.
Squalene, that's got some issues with it. Squalene is in and of itself is not necessarily a bad thing. It's not perfect, but it's used in a lot of like skincare products, and it's even some things that people may put in their mouth or eat. The difference is, if something's on your skin or even in your mouth, your body has different defense mechanisms to stop those proteins from getting inside your body and getting inside the blood cell. So you're not going to make an antibody to squalene if it's just sitting on your skin in the form of a skin lotion, because it hasn't gotten into the bloodstream yet. Your skin is a protective barrier. Your skin blocks a lot of things from getting inside your body. It's one of your body's best defense mechanisms. Even if you swallow something, your body has acids and stuff to break things down, to neutralize it, to kill things off. And so you can put a lot of different things in your body by eating them or putting them on your skin. You're not going to cause problems. But when you inject something directly into the bloodstream, and now your body can make antibodies to it, that's when you're going to end up creating problems. So you may see squalene in some of your different products. It's basically a fat or an oil. That's why it's used in skin products, because it's an oil. Kind of keeps things lubricated. So this is the molecule itself. That's what it looks like. Tulane Medical University did the study on squalene, found that it was highly associated with Gulf War syndrome. 100% of the people that didn't go to the Gulf War that have Gulf War syndrome have antibodies to squalene. 95% of the people that went to the Gulf that have Gulf War syndrome have antibodies to squalene. Whereas 0% of the people that went to the Gulf and don't have Gulf War, they also don't have antibodies to squalene. They weren't exposed to it. So if you went there and you don't have Gulf War syndrome, you weren't exposed to squalene. You don't have any antibodies to it. Now, this one's interesting. Multiple independent studies show that squalene is associated with autoimmune disease, such as MS, rheumatoid, and lupus. And so this molecule is apparently very similar to some of the molecules in your body. And so when your body builds up an antibody to this thing, this looks relatively close to a molecule that's on your joint, or a molecule that would cause MS or rheumatoid arthritis. So your body looks pretty similar to this stuff. So instead of those antibodies attacking this stuff, they attack you, which is what autoimmune disease is. So that's the concern with squalene. But remember, it's really only supposed to be in those two different shots. So the other problem is the rogue viruses and toxins in there. Remember, we said when the virus is growing on certain products, we get these rogue viruses in there, which is extra viruses that were not necessarily intended to be in there. They try to kill them with mercury and other things, but that's the problem with them. And so Random viruses make their way into the shot. These have been shown to cause cancer and degenerative neurological diseases. And that's why they say if you get a flu shot 5 years in a row, that your odds of having Alzheimer's disease go up by a multiple of 10. So not up a little bit, but by a multiple of 10 if you've had 5 flu vaccines in a row, because of all this extra stuff that's in there that can cause problems with the nerve disease. And here's the biggest concern, that you can actually pass it off to your offspring. And so let's say you're a college-age kid, you don't necessarily have kids yet, you get this shot, these random viruses go in your body. They can actually be passed just like AIDS or HIV is a virus that can pass to your offspring. These other random